No matter where you turn, emotion about coronavirus is strong. Fear about what's to come, anxiety that we're not doing enough, apathy, feeling that like this whole thing is overblown, and anger, feeling friends, neighbors, and even family aren't taking things seriously. But above all, the main thing just about everyone is feeling at this point is uncertainty, probably thanks in large part to mixed messages like this delivered just minutes apart yesterday.
It's a very contagious virus. It's incredible, but it's something that we have tremendous control of. Relax. We're doing great. It all will pass.
The worst is yet ahead for us. It is how we respond to that challenge that's going to determine what the ultimate endpoint is going to be.
With stories like ones coming out of Italy, where there are reports of medical professionals in tears as they have to make decisions about who lives and who dies because there isn't enough time or equipment to treat everyone, I'd say I'm inclined to believe Dr. Fauci on this one. Of course, today, Trump switched things up again, admitting the virus is not under control.
My administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible. Avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
But he stopped short of issuing any official orders on those counts. Here in Massachusetts, Governor Charlie Baker is making things official, ordering all schools to close for 3 weeks starting tomorrow, banning all public gatherings larger than 25 people. All restaurants are moving to takeout only on his orders or just closing altogether. And overall, our lives are looking a lot different today than they did a week ago. The show will be looking a little different to you, too, over the next few weeks. A lot of our staff is working from home, and we're limiting our in-studio guests as we adhere to social distancing guidelines. I'm joined now via Skype by Ann Prestopino, Senior Vice President of Surgery, Anesthesia, and Emergency Medicine at Mass General Hospital. She's also the Incident Commander for COVID-19. Ann, thanks so much for being here. I really appreciate it.
My pleasure.
Is MGH prepared, or hospitals in eastern Massachusetts prepared, if this virus spikes, as so many experts suggest it's going to do?
Well, I think it's fair to say that all the hospitals in eastern Massachusetts, and particularly the large academic medical centers, have really spent years developing our preparedness contingencies for these various kinds of situations. Most usually, we refer to these situations in the context of mass casualties, like the Boston Marathon bombing as an example. But there has been quiet preparation in the background for years for the eventuality of a potential pandemic. So, yes, we are prepared. We are very concerned, however, about the magnitude of the surge that might still be ahead of us.
When you talk about the magnitude of the surge and your concern, is the concern not about the lack of preparation? I think anybody who lived through the marathon would never question the preparation of our hospitals in this city, but about the equipment, the number of ICU beds. We're now hearing that the CDC is saying that these N95 respirators, which I guess stop 95% of airborne particles, that level is not necessary. You can go one layer down, which I know a lot of people, first responders, healthcare professionals, are concerned about. Is that what worries you about the equipment in beds being inadequate to meet a surge in infections?
It's basically three issues, Jim. It is definitely the number of beds that and how we can convert areas that we traditionally have not used for ICU care to those capabilities. It is the equipment as well as the supplies, so numbers of ventilators, the masks, the gloves, the eye shields that are required in the care of these patients. And it's also our staff. Because of the guidelines that are at the state level with regard to potential exposure and furlough requirements, that is impacting hundreds of people throughout the healthcare system here in Boston and greater Massachusetts. And so balancing the needs to keep our own staff safe, but also the needs of incoming patients is going to be quite a challenge.
When you mentioned keeping your own staff safe, and obviously I know it's a high priority, does that mean that despite the fact that the CDC is signing off on these less protective masks, that MGH would not sign off on that, such a thing?
No, it's not having to do with the equipment itself. It's more having to do with people having had exposure to a patient or more likely with others in the community through the socialization of others that then tested positive for COVID, where we have to keep people at home, that's causing more of the challenge.
What do you do when you do run out of ICU beds? Are you hinting at it a minute ago? You convert spaces that traditionally would not be used for this purpose, some in
Right.
hospitals, some outside the hospital?
Yes, for ICU capability, I believe it would really have to be within the hospital, or we would migrate more routine care more broadly. So just to give you an example, at Mass General, we have done a significant amount of reduction in already in our elective procedure area. Those geographies within the walls of Mass General are the kinds of places where you can provide critical care, both in the peri-procedural space, even in the operating rooms itself, in the endoscopy units, catheterization laboratory areas, et cetera. So we would expand into those spaces and provide ICU level care there. And we are blessed by having a significant number of those kinds of spaces in our main hospital campus.
Your boss was on national TV yesterday saying that we should be on a, quote, warlike footing for this. What did he mean?
I think he meant largely from the vantage point of making sure that the entire country is moving aggressively as possible with social distancing so that we can do everything we can to hopefully contain the spread of the contagion and make sure that we are not seeing the dramatic kind of peaks that other countries around the world are. And as importantly, that in the manufacturing arena, whether it's for basic supplies or for equipment that's required to care for these patients, that we're doing everything possible to up production in parts of the United States that may have the capabilities to do that, so that we are able to appropriately supply and equip our staff to take care of these patients.
Are we doing that wherever we could across the United States? We're not, are we, or are we?
That is not really my area of expertise. We certainly, from a supply chain perspective, are working throughout the world, quite frankly, to try and find alternatives to plants that either make the materials or the actual individual item themselves, largely coming from China, that had to slow production because of their challenges. And we're really trying to stay ahead of that curve worldwide as we look at where we might be able to source some of this very important supply and equipment.
Are you satisfied with the testing capacity you have?
No.
And what do you do about it?
Well, we proactively went out and purchased technology so that we would be able to do the testing in-house. I think CDC and state tried to do everything they could in terms of managing the preliminary numbers of tests coming through. We quickly exceeded their capacity. So it is the testing kits themselves, as well as the technology that's utilized to conduct these tests. My understanding that it is a very manual-driven test, so we also need highly trained technologists in order to complete this. We are not where we need to be with testing.
You know, I introduced you as the incident commander at MGH for COVID-19. You were the incident commander after the Station Club fire in Rhode Island, after the Boston Marathon. What similarities do you feel in your work around coronavirus?
I guess what I would say is probably the most important thing is just the amazing resiliency and absolute commitment of the healthcare community to deal with these kinds of situations. A pandemic's a very different situation than a mass casualty kind of events that the two other examples that you utilized presented us with. So the difference is obviously that you are dealing with a very immediate sort of onslaught of patients that need acute needs. In a pandemic, we are dealing with patients who have much more longitudinal needs,
Right.
and there's a tremendous amount of ambiguity about who needs to be tested, who can stay home, et cetera. Guidelines are changing both at the state and federal level, almost on a weekly, if not daily basis. So that's making it very challenging in a very different way. But the one thing that is consistency is really, quite frankly, the amazing commitment of the medical staff, the nursing staff, all of our support staff, quite frankly, that continue to show up every day and try and do the right thing.
Yeah, American Red Cross said today tons of blood drives have been canceled. Is blood supply going to be an issue for places like MGH coming up?
Blood supply is starting to become an issue. We were just discussing that today at our incident command meetings about whether or not we should actually try and encourage people to give blood. But if we do that, we want to do that at mobile sites where the social distancing rules can hopefully be applied.
If someone feels they have symptoms, what do they do, Ann?
If they have basic symptoms, we're encouraging them to stay home. It is only when the symptoms become severe that they should be in touch directly with their primary care physician, and then make the determination at that point whether testing is indicated, and or in the acute situation, obviously a visit to the emergency department.
Let's end where we began. What keeps you up at night?
Quite frankly, the number of people, the denominator of this situation, and how quickly the numbers are increasing.
Ann Prestopino, I really appreciate your time. Good luck with your work. Thank you so much.
Thank you, Jim.